Oh.
Well, that is Barbara DeGraff.
Oh no, I didn't chat. That is not me.
No, it's in your name.
It's in your name.
I know. I saw that and I'm laughing because that is not me. Oh, you know what that's from the registration, correct?
Oh, interesting.
That must be what that is. And that was why because in the registration they ask you for your successes, so I wrote that in there. That's why.
But that in your name.
I really haven't had many successes, and if I did, I'd be the first to share.
You've had many. Don't be so modest. Well, so it's almost 1 o'clock, so I don't know if we want to start because I think we have a good amount of folks here. What do you think?
I'm the sign language interpreter.
Oh, welcome. Hi, welcome.
I can't rename it to show that I'm the interpreter. It won't let me rename.
I will do it for you.
Okay.
And if Auntie or Lydia can make me a co-host, I can help with some of the back end stuff too.
Okay. Oh, there you go.
So I went ahead and did that. And then we have our captioner here.
Thank you.
Sure. Okay. Well, we're right at 1 o'clock, so we have a lot of stuff to cover. We want to make sure we give Elena and Althea the time they need to go over a lot of this information. But I wanted to welcome everyone to Aligning Funding Opportunities and Initiatives in California. This is a series we're doing, and this webinar is on funding to prevent homelessness with Althea Lyness-Fernandez, a housing specialist with the California Department of Social Services, and Elena Fiallo from Managing Operations Director from Population Change Institute. They will be able to introduce themselves and give you a little bit more information about what they do. Before we start, I wanted to bring your attention to some Zoom instructions. As you know, you have, I'm sure we're all experts, but I always like to point out a few reminders. If you need to mute or unmute yourself, we'll have some opportunities for some Q&A towards the end. You can press on the little microphone, which is on the bottom. It's the first icon on your toolbar. If you want to share your video, we always love to see your beautiful faces. But if you are not camera ready or you have to get up or whatever reason, or if you're not ready to share, you can always hit the little video camera icon on the bottom and stop sharing your video. If you need to communicate with us or you wanted to add any comments, please use the chat. And then also you can always use the reactions. I like them. They've actually expanded them. So there's like a smiling face, a laughing face, a thumbs up, anything like that. Please feel free to use those as well. Today on the call or on the webinar, this is the strategies team that is here to help support your experience and also to help facilitate the discussion today. My name is Lydia Marquez. I'm a senior technical training specialist with strategies at the Children's Bureau of Southern California. We also have Anvi Din, our amazing event coordinator. She helps us do everything on the back end of the webinars, and she will provide some technical support. And then also our co-director, Sarah Lacroix, who's also here today to help support us. I also wanted to just bring to your attention that this webinar has an associated learning exchange session. So what that means is it's an opportunity to have a more intimate discussion about some of the funding. So if you have maybe more specific questions, you want to know more about how to, either engage with this funding or implement this funding, we have the opportunity to do that with Althea and Elena at a later date, which is November 16th. And we will go ahead and drop a link to the flyer in the chat throughout the session today, so you'll have an opportunity to get the information. We'll talk a little bit more about that towards the end of our session. But I wanted to present our presenters, Althea Lyness-Fernandez, housing specialist with the California Department of Social Services, and Elena Fiallo, our managing director of operations at Population Change Institute. So I will go ahead and hand it over to them.
Great. Good afternoon. Thank you, Lydia, and thank you to the strategies team for having us here today. Before we get started, and we'll do some introductions, I would love to find out who's in the room, who's joined us for today's webinar, if you don't mind. In the chat, if you could put your name and the county or community that you're here representing today, that would be wonderful. I'd love to know who's here. And let me open that up. And I'll give everyone a few moments to just type that in. All right. Welcome to Barbara and Sarah from Butte County. Bo, Ventura, Marlo, welcome. Jennifer Rolls from San Diego, welcome. Adam from LA County. Great. Welcome, everyone. Everyone can continue to type in the chat. I'll introduce myself. My name is Elena Fiallo, and I'm one of the managing directors for the Population Change Institute. And we are a TA team similar to the strategies team. And we support the California Department of Social Services and their housing and homelessness branch with the expansion of their all of their programs. So we support counties that are grantees of the state funding and that are currently, doing a massive expansion of their program. And I'll turn it over to Althea to introduce herself as well.
Good afternoon, everyone, and thanks, Lena. My name is Althea, and I'm a housing policy specialist at the California Department of Social Services in our Housing and Homelessness branch. So right now, what that means is that my job is really thinking about also these expansions, in particular, our funding letters and our guidance. So really excited to speak with you all today and hear your questions, get your feedback.
Okay, so first, and if I could ask Lydia to go to the next slide, please, or a couple slides, I think. There we go, one more. Yeah, so first I wanted to just thank and extend some gratitude to Marlo Nash, who did a great session in October. She provided a lot of great data on how COVID-19 is really impacting families in our communities and all of the relevant funding and provisions that will provide some resources to those families that were experiencing negative impacts from COVID-19. If you didn't get a chance to catch that webinar in October, I think the team can put a link to the video and perhaps the PowerPoint in the chat. I definitely encourage you to check that out. It was really an excellent session. So today we're going to be, and I'll ask you to advance the slide. One more, there we go. Today we're going to be discussing some of the funding being made available to your counties and communities aimed at addressing homelessness and the prevention of homelessness for individuals and families. So we're going to, I'm going to kind of set the context for today, and then I'll hand it over to Althea to do the heavy lifting on talking to you about what is the Housing and Homelessness branch of the California Department of Social Services and how that fits in with the broader housing and homelessness system in our communities. Talk through the current program expansion landscape and the key principles that guide our work in homeless services. And then she's going to talk about the funding opportunities for children and families, and with a special focus on what's new and what's different this fiscal year. We'll go to the next slide, please. So I realize that as excited as we all are, and as I am, about all of these new investments in our communities, I also want to keep at the forefront that there's a lot of money and a lot of information coming at all of us very quickly. And that can be really overwhelming, and it can create a little bit of anxiety. And, you know, I would like to enter into today's conversation in the spirit of like staying in a generative space and really thinking about what these unprecedented investments in our community really mean for the way that we can realign our systems, the way that we can rethink and redesign how we deliver services in our communities. So just to get us all in the room and to really just get into the space of just what are the possibilities and opportunities, I wanted to ask everybody this question. What are you most excited about with these new community investments? Of all that you've heard so far, with all the funding coming down, what does that really like, what does that help you to become excited about in your community? And if you could just enter that in the chat, I'll give you a few moments. Thank you, Bo. Yes, housing foster youth as they age out of the system. Yeah, that's right, Sarah. Like, I think that's right. There's so many, you know, I think we're beginning to recognize and have these conversations that, you know, sort of change at the system level really needs to be a top priority with our funding streams. And Marlo, yes, the flexibility, and Althea will talk a lot about that today. There's a lot of flexibility built into these funding streams, and especially with the focus of coordination and cross-system integration. Yes, thank you, Barbara. Yeah, the opportunity to fund services to support families. Yes. Rachel, families who are at risk of court involvement due to homelessness or housing issues. Yes, that's kind of where we want to think about today. Like, where are those areas that we can be really innovative and really be thinking about aligning things for our families? Great, Sarah MacArthur, possibility of sustainable supportive housing for children and families. Yes. Okay. And Sarah, you said you were you Butte County? What county are you representing?
Yeah, Butte County.
Butte County, yes. There's been a lot of devastation up in Northern California, so it's been really tough. Even making it, you know, the issue of homelessness even more dire, right? A lot of new folks entering into that system. And Lydia, yeah, giving orgs the breathing room to do the work they really want to do instead of just crisis intervention. Yeah, I think that's really important. And, you know, as this, you know, sort of all this funding comes out at a really rapid pace, you know, really taking the time for, you know, all of us that are in, so that want to, you know, sort of see the opportunity, really taking a moment to reflect and to just breathe and to really be planful about what we want to accomplish with these new investments, right? You know, I've worked in counties before, you know, you're moving at, you know, just an unimaginable pace. And it is often really hard to be planful and to have that space to do that. So yes, I think like really focusing on bringing in that, just that space of reflection and why we want to do things and how we could really, you know, align things for the betterment of our families. So I just have a few questions for you before we get started to help us tailor a little bit the conversation today. So I'm going to ask Anvi and the team here to launch a poll just to get a sense of how well you sort of interact with and know your homeless systems of care. So the first question is, are you familiar with programs that address homelessness in your community? These are all yes or no questions. Do you have an understanding of funding coming from the state to address homelessness or homeless prevention? And the third question is, are you already in conversation with your homeless systems of care about how to best position resources for families at risk of homelessness? I'll give everybody a moment to answer those questions.
So I have a few more seconds for folks to put their answers into the poll. I'm gonna go ahead and shut this in 5, 4, 3, 2, and 1. And then I'll share those results.
All right, so people are familiar with programs that address homelessness in their community. Not necessarily understand the funding that's coming down, so that's great. That's why you're here. Wonderful. It's great to know. Some of you know a little bit split. And then are you already in conversation? So I'm really glad to see 57% of you already in conversation with your homeless systems of care about how to position these resources that are coming for families. That's a really wonderful, I know we're a small group, but it's really great to see that people are already thinking and talking about this. Thank you. I really appreciate you answering those questions. All right. So if we could go to the next slide, please, Lydia. All right. So just to kind of set this up, and then I'll turn it over to Althea. There's really an unprecedented investment by the state of California in our community systems. And that is coupled with the federal investment to address homelessness in our communities. And it really offers us an opportunity to redesign our systems to best serve individuals and families. The idea for this webinar and this webinar series came about through multiple discussions with the strategies team about what they were really hearing on the ground in sort of talks with counties that are doing child abuse prevention planning. Like, what is some of the #1 concerns for counties, you know, and their families, really? And I'm sure that you can all guess that part of what was coming up as a primary issue for folks is housing instability and economic instability. And at the same time, in our homeless systems of care, we're really grappling with, like, how do we slow down the influx of individuals and families into the homeless system? And we know, you know, sort of through data and anecdotally, that that housing markets are really tight. Like Sarah from Butte County was just saying, made further tight by, you know, recent fires and events in the community. Our housing market is like 1%. You know, we have 1% vacancy in our housing market, and so really, like, keeping folks housed is the best option. It's like keeping people in their housing, safely in their housing, is our best option. And if we can, at the same time, connect folks to wraparound services and supports in the community context where they're already showing up, that's even better. And that would ensure 2 primary objectives: really to get people resources that they need to stay housed quickly and before it becomes a crisis and they're really sort of then entering the homeless systems of care. And 2, we really want to ensure that folks have the support they need to not only maintain their housing, but to wrap the right level of services around them so they can thrive in housing. So on our side, we're going to talk today about the housing resources that are coming available to ensure that people stay housed, right? That's what we have on our side. And on your side, you have some of the wraparound services and some of the investments into place, right? Into safe places where families already come for support, family resource centers, community schools, and other, you know, services that are already available to families in the community. So the question really becomes then, how do we team up, right? How do we take advantage of these new investments and really figure out how to align our service delivery systems? How do we make it easier for folks to thrive in our communities? How do we switch from a paradigm of scarcity and we don't have enough resources, so who's the most deserving framework, to what would it look like to make resources widely available so that we could prevent the stress of homelessness and prevent the incidence of child abuse and neglect in our communities, right? What would it look like to make, you know, just sort of throwing out some ideas, what would it look like to make resources and rental assistance available within our family resource center networks? Going back to an idea that Marlo mentioned in our last session, what if we could expand home visiting within our permanent supportive housing or within our rapid rehousing programs? These are the kinds of ideas that we can pilot and test with these new investments. So I really just want to, be in a generative space today and think about all the possibilities. I know there's a lot of problems with our systems and they need a lot of work to make them function well, but what are the possibilities if we sort of sit at the table together and leverage our resources together and really think about making it much more accessible and easy for our families to navigate our services. So with that, I'm going to hand it off to Althea, and she's going to do the heavy lifting on really talking through what's coming down the pipeline right now in terms of funding for housing supports.
Thanks, Lena. And yes, I'm very excited, always excited to talk about our programs, but really excited to talk with you all today because I think you'll also have some great ideas and some great feedback about, how housing and programs that support, child well-being can further integrate, further collaborate. So just excited to be here and thank you for having me. Yes, as Elena mentioned, so the goal today is really to provide an overview of the California Department of Social Service Housing and Homelessness branch programs, and especially those programs that serve children and families who are experiencing homelessness or at risk of homelessness. And I also want to share some ideas, some principles, priorities that are guiding our work right now. I think that might foster some great discussion and think about how all of you can tap into this evolving and important work. And also mention that I was really glad to see glad that we did the poll because it actually, and seeing those introductions, because I imagine just hearing some of your your titles and where you're located within the county, I think there may be some of you that are actually maybe familiar with, are implementing, or have heard about our programs. So, eager to see if we have a mix of folks who are who haven't heard of these programs and others that might actually be implementing. I think that could be great fodder for discussion. Okay, so first, a little bit of context about where the branch and the department sits within the broader housing and homelessness landscape. So our branch is focused on programs that function at the intersection of housing and social services. As we know that social service programs are a key access point for individuals and families who are facing a housing crisis. So our goal is not only to end homelessness in partnership with local communities, but also to increase access to social services across the board. And in 2020, our program served over 100,000 individuals. And of course, we also work in partnership with other state agencies that administer housing and homelessness funding. And so those are, for example, the California Department of Housing and Community Development, HCD, and HCFC, which is the Homelessness Coordinating and Financing Council, although I think they're about to have a name change. So we coordinate with them as well to deliver services. And at the end of this, I will put in the chat a document and a guide that was created by HCFC that lays out some of the funding streams available for homelessness programming in communities as kind of a go-to to help you piece together this picture. But today I will be focusing on the housing and homelessness branch within CDSS. So as you all might know, and as Lena mentioned, we're at a really critical and historic juncture right now in the housing world. So the state issued a $12 billion package over the next 2 years to address housing and homelessness. And as part of that, our department received just over $2 billion in funding over the next 2 years, which is a really significant expansion in funding. And I'll touch more on this shortly on those specific programs, but just keep in mind that we're currently facing these challenges and great need around family housing instability and homelessness with more resources available than we've ever had before, which means this is the critical time to be in collaboration and conversation to make the best use of these opportunities. I also want to share two additional changes that were made alongside the additional investment to frame this conversation before we go more in depth. First, we recognize that it's important to focus on stemming the growing number of people who are entering homelessness. And as a result, as of this fiscal year, and we're still issuing guidance around this, but our family programs can now be used to offer homelessness prevention services, in addition to continuing services for people who are currently experiencing homelessness. A second one, and for those of you who I imagine probably everybody on this call since you joined it, but who are thinking about these funding streams in detail, local match requirements in many of our programs were also temporarily waived. So again, this is also a great time. We know sometimes those waived match requirements can facilitate a faster ramp up among new programs and also help existing programs scale up. And with those two changes and flexibilities, as well as the additional investments, we really hope to see all of our programs in every community across the state. We have a subset of programs that have been in pilot mode for the last few years. So seeing their tremendous impact in communities, we're really eager for all Californians in need of them to have access to these programs. Okay. Oh, sorry, can you go back the slide? Thank you so much. So now I'm going to talk a little bit about the need. And I know that all of us know here that homelessness is a crisis, that we have a housing crisis right now, but want to set the stage a little bit so that we are centered around the need that we're facing. So in California, as you'll see on the screen, there has been an overall increase in homelessness since about 2015, especially an increase in those who are homeless and unsheltered. We see chronic homelessness rising as well, and as I mentioned, unsheltered homelessness. One of our, apologies, hold on. There we go, okay. We do see family homelessness, decreasing by 8% from 2007 to 2020. And while we're glad that it's not rising, it's still too many children, too many families who are currently unhoused. And we're certainly not yet at our goal of ending family homelessness, which would mean that family homelessness is rare, brief, and non-recurring. And again, I know I'm preaching here, but the stakes are really high for children and families. We know that housing instability affects a family's ability to manage their health, safety, education, employment. There's plenty of research that shows how housing instability can be a precipitating factor for involvement in the child welfare system, which in turn can impose additional stress and trauma on children and families. So when thinking about preventing harm to children and families, as well as improving family well-being and opportunities for self-sufficiency, housing and homelessness prevention really must be part of the conversation. Next slide. So housing is not only a foundational and stabilizing force for a family that's involved in the child welfare system or other systems, but it's also a tool to prevent and lighten that involvement in the first place. And of course, no one organization or agency or entity can do it all, which is again where partnerships come in. And there are numerous reasons why it is critical for housing to be integrated into social services and for those linkages to be available to families. So why should we partner? First of all, we know that homelessness affects multiple facets of a family's well-being, but also different policy and social systems. So recognizing those intersections within the systems is critical for children and families to thrive and resolving homelessness system-wide. Second, social services already work with some of the most vulnerable folks in our communities and folks that are most at risk of homelessness or housing unstable. Caseworkers know this and have known that many families that they work with are facing housing instability. And so with these programs and the additional investments, there are now additional resources to couple traditional case management with housing expertise and resources in order to specifically address a housing crisis and homelessness. And then finally, integration between social services and housing allows us to deliver services in a more client-centered approach. So of course, it takes a lot of work on the back end, behind the scenes, a lot of coordination, a lot of communication, but the goal is really to make these services delivered almost seamlessly to the client, that when they go to one touch point within a social service system, that they're able to access, even if it isn't a housing program, that they're able to access housing resources if they're in need of them as well. Next slide. So this is the kind of the framework for our department and our branch's approach. Identify key systems and programs that are already working with individuals, children, and families who are experiencing homelessness or most at risk of homelessness, and ensure that there are comprehensive housing supports at the ready and as an integrated part of the safety net. So our branch currently manages 7 programs. 3 are aimed at families with children, and 4 are aimed at seniors, adults, and people with disabilities. And so I've listed these here on the screen. And just a note on how these programs are administered. So our department's funding is available to county departments of social services, or for most programs, tribal government agencies. And these are the entities that can apply for funding. However, these local departments often partner with other county departments or agencies or community partners in order to carry out the work. So each community has the ability to really design a program and enlist the right partners for the task at hand. So look a little different in each community. And I'll be going in depth on the children and family programs, which are the Housing Support Program and the Homeless Assistance Program, which support families in receipt of Calworks who are experiencing or at risk of homelessness. And I will also be talking about Bringing Families Home, or BFH, which supports families in the child welfare system who are experiencing homelessness or at risk. But we do have another set of programs aimed at seniors and adults with disabilities that can support families as well. They're just not specifically designed that way, but we certainly have families and households that collaborate and are recipients of the program as well. So I do want to keep that in mind, but I'll be focusing on the family programs today. Next slide, please. Okay, so I'm going to start off with Calworks Homeless Assistance Program, or HA. And this program was established to help families who are apparently eligible for the Calworks program to meet the costs of securing or maintaining permanent housing, or to provide emergency shelter when a family is experiencing or at risk of homelessness. So this program is an locally administered entitlement benefit available in all 58 counties. And this is the only program that I'm going to be discussing today that is an entitlement benefit. So just want to flag that this program is structured a little bit differently than the rest of our cohort of programs. There are generally 2 types of benefits. One can help families find temporary shelter for up to 16 calendar days within a 12-month time period. And the other one is to assist families in securing or stabilizing in permanent housing. So these are sometimes referred to as temporary HA and permanent HA. Next slide. I just want to call out just really the scale of this program and how critical it can be as part of the social safety net. So in FY 2019 and 20, over 50,000 families received temporary HA and nearly 6,000 received permanent HA. That's so many families in California. And again, this is an entitlement benefit. So a really key part of the social service safety net. The following, so in FY 2021, around 30,000 families received temporary HA and about 1,600 received permanent HA. And for those wondering, counties have reported that the eviction moratorium was a leading cause of that decrease in approvals. But this, longstanding program has, a great track record of being able to provide immediate supports to families who are seeking shelter. Next slide. So the Housing Support Program is another one of our programs that is focused around families in the Calworks program. So HSP assists families in securing and maintaining permanent housing as quickly as possible and without preconditions. So housing is not contingent upon participation in other services such as case management, although those things are offered. HSP offers financial assistance and housing-related wraparound supportive services. That could be rental assistance, housing-specific case management, assistance finding and securing and applying for units, providing security deposits or utility payments, moving costs. It can also support hotel and motel vouchers or other forms of interim housing. And if needed, connections to things like legal services or credit repair that help families address some of their barriers to housing stability. So for this fiscal year, FY 21-22, $285 million was appropriated for HSP. So this includes the $95 million annual ongoing appropriation. And that funding has already been issued. But on top of that, there was $190 million one-time appropriations for HSP. And those funds can actually are available for encumbrance or expenditure through June 30th, 2024. So issued this year, but available to be spent for the next 3 years. And these are the funds that we are working on announcing shortly in an upcoming letter. But again, looking at that magnitude really shows you how many resources we have available to communities, and hopefully very soon in the hands of local communities to support children and families who receive Calworks. Next slide. And this is a really key program. And I think this is such an important statistic, the first one, that 85% of families who touch the homeless system are receiving or were recently receiving Calworks. And for that reason, we really think that scaling this program is the most efficient, direct, and holistic way to address family homelessness. Since the program's inception in 2014, more than 25,000 families have been permanently housed. And not only are we able to connect more families to needed services, but HSP grantees report that with their funds, they've been able to create better linkages and better partnerships between social service agencies and the local homelessness response system. They also report that a lot of the core components of HSP have supported families in addressing barriers to housing that most families couldn't do alone while experiencing homelessness. And again, recent statutory changes have made families at risk of homelessness also eligible for HSP. And we'll be issuing guidance around this in the forthcoming letter, but we're really interested and eager to see how communities might harness these additional resources paired with the flexibility to provide homelessness prevention services over the next year to serve, next few years to see how communities will change their program designs, expand, scale, and reach even more families and children. Next slide, thank you. Next program, we're transitioning away from Calworks, and now we're going to talk about bringing families home. And I think there was someone in the chat who said that they were interested in housing supports for families in the child welfare system. Well, that would be BFH. It aims to reduce the number of families in the child welfare system who are experiencing or at risk of homelessness, and also aims to increase the number of families who are reunifying and prevent foster care placement. So similar to HSP, the type of housing intervention really depends on the family's needs. So it could be rehousing, connections to permanent supportive housing, helping families stabilize in current housing as well. And this could be done by a variety of supports and services such as, again, rental assistance, housing navigation, case management, utility payments, and moving costs. So a lot of flexibility here as well, knowing that, of course, each person and each family's journey to housing stability looks a little bit different. So we want our programs to be able to match that need. So in this fiscal year, FY 21-22, 92.5 million was appropriated in one-time investments available for expenditure through June 30th, 2024. And the same amount is expected next fiscal year as well. And for a sense of magnitude for this program of the expansion, previously there was 25 million over the course of 3 years. So now it's 92.5 million over the course of 3 years, plus another 92.5 million next year. So a lot of resources. For those of you familiar with BFH, previously there was a match requirement, but now it is match exempt. There's a match waiver. We hope this funding will be available locally as soon as possible, hoping for end of the calendar year. And this is in particular a program that we're hoping to scale to new communities with the expanded funds. BFH was a program, off the top of my head, I forget how many grantees we currently have, but we are not yet in every county in California. So that's one of our priorities, is to scale and expand the program. And tribal governments are also eligible to apply for this program as well.
Yeah, there's a couple questions in the chat. I don't know if you want to hold them to the end or if you want to take them in the actual sections.
Yeah, why don't we, I'll take it now. I think that makes sense. And if you go too long, sometimes you lose the context a little bit. So yeah, that's a great idea. Why don't we pause and just take a look at the questions. So one question from Sarah is, when will the info on reapplication drop? I think that was, I'm not sure if that was HSP or BFH, but I'll tell you both. So we are currently in the process of issuing funding letters for all of our programs. HSP, the funding amount was, the annual amount was already issued, but for both the one-time funds, for both programs, we're working to do it as soon as possible. So HSP will be the next one to be issued. And we're looking at a timeline probably around the end of the month. And for BFH, we're looking at end of calendar year for those applications. The match exemption is, I will look at the statute, but it is a time period for awards issued within that time period. So I think it's for one-time funds issued between beginning of this fiscal year through June 30th, 2024. Are undocumented families able to access these housing programs? I'll confirm this, but I believe all of our programs, there are services available and ways to support undocumented families. Of course, we know that undocumented families often do have a harder time accessing the social service safety net. So, that's not to say that there are not barriers. I'll double check on the eligibility, but I remember last time I had a conversation about this, it was confirmed that being undocumented does not disqualify you from these programs. So I think those are the questions. And if folks have other questions as I go through the program, especially ones that are really program specific, yeah, feel free to put those into the chat, and I will try and keep an eye on the chat as well, but we will have Q&A time at the end. Okay. So back to BFH. As I mentioned, this is one program that we're really, really excited to scale to new communities. So from program implementation through June 2021, more than 1,500 families have been permanently housed through the program. Grantees report that BFH helps them reunify faster and with higher success. And similar to HSP, that a lot of families didn't have access to some of the housing stabilization services and some of the resources and referrals needed to really address barriers to obtaining and staying in housing. This is also a really, when we talk about integration within social service safety net, this is a really great example about how supporting housing needs for families also helps achieve goals for the partner program. And so one thing we see from grantees is that they have reported that the housing security afforded through BFH assists families in better achieving their child welfare case plan goals, their service plan, and meet faster timelines to visitation. So this again is a program that statutory changes allowed homelessness prevention to be offered through BFH. We'll detail guidance around that in the upcoming letter. And so we're really excited to see this program scale in existing communities as well as new ones. Next slide. So, yes. So, before we turn to questions, that was the deep dive into our program, so you have a sense of how they function, what kind of services they provide, and who they serve. But before we end and turn to questions specifically about these funding opportunities, I do want to mention some key principles and priorities that impact all of our programs. But also to give you a sense of what's unfolding and what you might see come out of these programs in the next couple of years. And again, I think these are things that might really be good catalysts for conversation, as well as I know that while I'm looking at this with a housing lens, that many of you are probably thinking about similar priorities and principles from a different angle. So next slide, please. I want to frame a little bit our expansion to homelessness prevention services, which again is new for many of our programs, and certainly our child and family programs. And right now we're really thinking about how to integrate homelessness prevention services into our existing housing and homelessness programs, and how to make the best use of this new allowability. So just to level set a little bit on what homelessness prevention services look like, preventative services can really be anything that helps save a tenancy, helps individuals and families regain stability in current housing, or move and achieve stability in a new housing location. And those, again, interventions can be really varied, but commonly, rental or utility arrears are a big part of that, cover late fee payments. Often there's some type of, there could be a landlord mediation or negotiation that a caseworker helps facilitate, perhaps repairs, home modifications to make it accessible, and again, housing navigation if what the family needs is to move to new housing. And while we're still finalizing the exact guidance for our programs, there's a couple of tenets or guiding principles that I want to share with you all, or things that we think are really important for our grantees and for us to be thinking about during this expansion period. So first, we just want to acknowledge that homelessness prevention may require different types of program designs, may require new types of partners. We think it'll definitely require new types of partners. And so one thing we're encouraging is for grantees to think about how to create program designs that can effectively serve families across a spectrum of housing needs. So how can you create a program that might be able to serve someone who is a family that is currently unhoused or in a shelter, while also helping a family divert from a shelter as well. So that's something that I think I would love to hear from folks is to be effective in homelessness prevention, what kind of collaborations, what kind of touch points should should our grantees have to be able to effectively deliver homelessness prevention services to families. Another framing principle, oh, sorry, still on, yeah, there we go. Another framing principle for our prevention guidance is the assumption that families involved in social services, and in particular, I just discussed child welfare services and Calworks, are likely already more vulnerable to homelessness than the general population. And because our programs are so integrated into social service safety net already, there's kind of a degree of built-in targeting of homelessness prevention services already. And for that reason, our programs operate around defining at risk of homelessness based on self-attestation and self-determination. So participants are allowed to attest verbally or in writing that they're facing housing instability that puts them at risk of homelessness. And for the purposes of eligibility, our guidance is that programs may not require additional verification or documentation, again, for the purposes of establishing eligibility around risk of homelessness. And we hope that this will decrease the amount of hurdles that families have to overcome to receive the services that they are eligible and in need of. And then third, if a program isn't able to serve all eligible individuals or families due to resource availability, how do you identify the families who are most at risk of homelessness? And we try and draw on research here as much as possible, although this is an evolving area of research. We have a lot to learn still on how to most effectively deliver homelessness prevention. But there are there's some good research out there that points us to some key indicators. And as part of our guidance, we've in funding letters that have already been issued, we've suggested prioritizing families who have children under 2 years of age, who've previously been homeless or are not leaseholders or have been in a doubled up household. So again, prevention is a new undertaking for our family programs, but we're drawing on these ideas and tenets to frame our approach. But more than anything, we're also in a listening mode, and we want to hear how communities want to use these resources, what they're seeing as the best ways to operate and deliver those services. So, we are, again, in listening mode, and would also love to hear from you all about what you would want to see from prevention, from guidance on homelessness prevention for these programs. Next slide. Okay, just a couple other kind of program requirements that I think frame how we approach our work. So first is housing first. All CDSS programs operate under a principle called housing first. And that means that individuals and families should be connected to housing or housing supports immediately and without precondition. This means that you can't hold off on housing until a person is quote unquote ready for housing. It means you can't reject someone from the program because they have past evictions or are low or no income. You can't reject someone from a housing program because they have substance use or behavioral health conditions as well. It also means that services are voluntary and client choice is respected throughout the entire process. Housing First is required by law for all state-funded housing programs, but it's also the most effective route. And there are also studies that show that connecting someone to housing as quickly as possible is more effective in fostering stability and well-being than waiting for preconditions to be met before putting somebody or connecting someone to housing. So even if you all don't operate under officially under a housing first requirement, I encourage anyone serving families to adopt this mindset too. I think it's actually a very expansive and important mindset. So if a family is in need of housing supports, don't wait. Don't hold off on connecting people to housing supports just because they have had difficulty maintaining housing in the past, for example. Another key tenet is racial equity. And our programs are, and our grantees are required to commit to addressing racial disproportionate, oh, that's a challenging word. That's one of those words that you write and don't really say as much. Racial disproportionality for people experiencing homelessness, and ensuring provisions, equitable provisions for Black and Indigenous individuals and other people of color who are disproportionately impacted by homelessness. So we know that Black and Indigenous people experience homelessness at significantly higher rates than white people, largely due to longstanding historical and structural racism. And this wow, I need to strike that one for my talking points. We know that this is all a byproduct of system inequity, of structural racism that continues to perpetuate disparities in these critical areas. And this is a big priority for us in the next couple of years. We really want to provide technical assistance to grantees to help them adopt a racial equity framework within their planning and programming. And we've tried to weave that into our guidance as well, and we'll continue to look for ways of improving. So for example, when we ask grantees to think about housing assessment tools, we ask them to think about racial equity as part of a framework for those assessment tools. And then last, we require collaboration and partnership with the local housing and homelessness system. Local continuums of care are, for those of you that might not know, are local planning bodies, sometimes county specific, sometimes more regional, that manage housing or homelessness specific resources. So we do require that grantees collaborate with the COC for all our programs. But even for homelessness prevention programs, this is important. Even if you're not necessarily referring someone to the COC, you should know how to connect families to more intensive supports should their needs change. You should be in communication even, again, even if you aren't doing referrals, and some COCs are looping in homelessness prevention work more than others as well. We also want to encourage collaboration to be far and wide with your partners. So think about partnering with housing authorities, tribal housing entities, medical institutions, emergency response systems, legal aid, and who you partner with is also about who you serve. So for family-focused programs, thinking about partnering with schools and family resource centers, local first fives, and more. These partnerships are never going to look the same, but at least aim to share information, have an open line of communication, know how to connect people to the right resources, and learn from each other on how to better support and holistically serve children and families. Next slide. All right, and lastly, I'll leave you with some things that we are thinking about as priorities for the next few years as well. So one is we have tribal government set-asides for 3 of our programs. One of those, as I mentioned, is bringing families home. So the tribal set-aside for BFH, I believe, is $5 million, and it's specifically to fund new programs with tribal governments and within tribal governments. But we also, even if there isn't a formal collaboration or program established within a tribal government, we do generally also want to encourage more partnership and more communication between counties and tribal governments. And we've heard a lot of rumbling of interest and are excited to see different potential program designs or ways of structuring that collaboration. But we really want to make sure that it's part of our conversation as we think about these additional resources. And we will have an additional funding letter that will announce the tribal set-asides and initiate a process for new tribal government grantees to establish a program. Then the next 2 points are I think, really about scale, about how we grow these programs especially now that there's prevention as part of those programs. So one of those things that we're thinking about is creating regional programs where several groups of counties or counties and tribes work together. And we think this could be especially helpful for scaling or even establishing programs in smaller, more rural communities. We think it's efficient to share administrative structures, and some of the barriers like small caseloads and hesitancy to develop a whole county specific administrative service structure. Some of that is lightened when you work regionally. So I'd be curious also if that's something that that you all are seeing in your programs and spaces, because we think where there are more shared regional structures, the easier it'll be to maybe facilitate some of those collaborations among your neighbors. And then also we just want to be thinking and open to innovative and strategic uses for this funding, whether that's flexible contracting or piloting new approaches to partnerships, or more effectively delivering services to families. So that's kind of an open question that that we're thinking about, and that we're asking grantees about, is how can we encourage and incentivize some of these new ideas as well. All right, next slide, please. Okay, so I know that especially if you are not so familiar with housing and homelessness resources or our programs, that it's a lot of information, a lot to take in. So want to offer our housing inbox as a place where you can ask questions, in addition to, of course, now that we'll have some time for that and in future learning exchange. But if I could leave you with a couple of takeaways or pieces of information that I think are really key. First, that housing is a key part of the social service safety net for families. And if a family is homeless or at risk of homelessness, housing should come first and as a foundation for well-being, not as something that comes with strings attached or prerequisites. At CDSS specifically, our programs, which are locally administered, our family programs center around Calworks program, as well as child welfare service involvement. And with these additional investments and the flexibilities around prevention, there is a great window of opportunity for communities to improve connections between housing and social services. And again, those funding letters will be issued as soon as possible, but really looking towards the end of calendar year timeline for the last one. And again, probably HSP is coming first, followed by BFH. So the funding letters are in the works, will be released soon. And so now is really the time to get in touch with your local partners. If this is a program that you want to work closer with or learn more about how it operates within your community, definitely reach out. I'll put this in the chat, but you can get that contact information at our website, or you can also email the housing inbox and just let us know who you are, what county you're from, and what program you want to be connected to. We might be able to facilitate some of that as well. But we have the opportunity to serve, more children and families who need housing supports. But we also have the opportunity to make bigger and systems level change and ask questions, bigger questions such as, how should we integrate housing within children and family program? Or how do we uphold racial equity in every aspect of programming? Or how do we make these programs actually responsive to the needs of tribal communities? What flexibilities can we build in to make sure that this program works for them as well? And of course, how do we scale to every community in California, every county in California? So with that, I know that some questions have come in, so I'll pause. Are we ready to go to questions and answers, or am I skipping ahead there?
No, you aren't. Thank you so much, Althea. I learned so much about just the different programming. I wasn't aware of that, and getting a little bit more context. So I appreciate that to both you and Elena for setting the stage for that, sharing that information. So there's a couple of questions in the chat, and I will just go in order. Jennifer Rolls-Royce asked, are there any funds being used to develop affordable housing? She's mentioning that in San Diego, you know, it's really pushing people out of the market, especially families who need larger units.
Yes, so this is where, and I'm glad that this question came up first because it gives me a chance to drop in the chat the resource that I said I would put in the chat and didn't. So I would really encourage everyone to look at this funding guide around housing and homelessness from HCFC, because you know, these programs are not focused on, for example, the construction of new affordable housing, or you know, there's programs, I'll mention a couple here that are a little bit more directly focused on that, which would be things like Home Key, which is managed through HCD as well. But what I will say is where I think this plugs in and supports maybe not the development of affordable housing, but like the preservation of affordable housing. It's really important that when, you know, families are already housed and in a good spot, that they're able to stay there. And so I think, you know, especially with the prevention side of things, opening up a little bit more, wherever we don't have to rehouse a family, that's a really big win. And so the flexible services to, for example, do like rental back pay is really critical. But also, you know, there are some of our programs that can also, as I mentioned, maybe like make a home more accessible. For example, if there's someone who has a disability in the family and the home is really not accessible to them, work on that. So again, really make their housing situation, you know, more stable and sustainable for them. But for funds that are a little bit more around development of affordable housing, that's certainly underway as well. Just, you know, is managed by other state agencies.
Can I add to that too, Althea? I think that was a great explanation, and thank you for your presentation. It was great. You did a great job. So just to make things extra confusing, in California, there are several state departments that are agencies that are responsible for housing and homelessness. And so CDSS, the Housing and Homelessness Branch, is one of those sort of routes that is really focused on housing supports and services. And there are other agencies that are responsible for the actual brick and mortar development of housing, and primarily, Althea mentioned HCD, housing and community development. So those NOFAs are being released as we speak, right, for the actual construction of affordable housing. So it kind of lives in a different place, but it is happening. There's a tremendous amount of investment on that side as well. I think with these programs that Althea just spoke about, we're really sort of tackling three things, right? Like Althea said, one is preventing homelessness by keeping people housed. And the, you know, the second one is really to capture that portion of the tight rental market, right? That these are focused on really work, you know, we have the opportunity to really develop some system-wide landlord engagement strategies and develop pockets and pools of money that allow us to sort of say, hey, look, we have guaranteed rent. We have, we can pay arrears, we can pay deposits, we can hold units, we can help you to upfit your units to make them more habitable over time if you know, are willing to rent from us. So we're trying to capture what is available in the rental market through some of these programs, right? So that's a really important aspect of this, is that we're preventing people and keeping them, preventing them from becoming homeless and keeping them housed, and two, capturing what is remaining in our tight rental markets. We're capturing those landlords and bringing those units online for our folks that are experiencing homelessness or who, you know, are unstably housed. So I think those are the two things that are really being addressed in, I said three, but two things that are really being addressed with these funds.
Great. The second question is, are any of these programs or services, maybe BFH, going to change or tie into the new FFPSA Part 1 requirements. And the Part 1 requirements have to really do with preventing foster care placement. And I don't know, Sarah MacArthur, if you wanted to unmute to provide a little bit more clarification on your question.
Yeah, I was just wondering if we're talking about homelessness prevention, and if any of those prevention services are gonna, I know that we have things like the FYI vouchers and stuff like that that are targeting youth in foster care or formerly in foster care. And I was just wondering if any part of this is gonna tie into FFPSA Part 1 specifically, since it's about prevention.
I think that's partially why we're having these conversations, is to figure out where we can make those ties and linkages across our social service delivery system. So I think back to Althea's question is sort of like, how can we leverage one another to really accomplish more, right? I would love to have that discussion, and maybe we'll save your question for, it's like, as things happen, we plan and release funding in our respective silos. So it's up to the folks on the ground to really think about how do we tie those together. And so I would love to have that as a group discussion in our learning exchange, like how do we tie them in, right? What are the strategies that we want to use? If, I would just like to open up that conversation to the rest of the group to see what kind of ideas we can generate.
All right. And then Adam had a question. You mentioned that these housing services are administered locally. Is that typically by a county social services department or division, or ever through their housing authority?
Yeah, great question. So the CDSS funding is available to local or county social service departments. But a lot of times a community might decide that the best way to actually operate the program is potentially through, not so much their housing authority. I don't think that's as common, but through maybe their homelessness services, or through like a different department. Housing authority tends to be like, the programs aren't usually administered out of the housing authority, but often, and especially I would say, I think this happens quite a bit with BFH, although I'm sure HSP as well, is that they really work carefully with housing authorities. And especially we've heard like the most success when there's someone who knows the housing authority staff very well and is able to, for example, even like do some of the initial groundwork to apply for a voucher that a family might be eligible for. So not through their housing authority usually, but sometimes other spots within the county and within the community outside of the social services.
Yeah, Adam, there is a wide variety of ways that people administer the funding. It does come through their social services department. Sometimes I have seen it come through the housing authority. However, I will say that it's not all.
Oh, that's fun.
I have seen that happen. Not the children and family programs, but some of the other programs that you alluded to that were for individuals, Althea.
Yep.
So there's a wide variety of ways that county departments are integrated within their continuum of care, which is the main sort of point of distribution of federal dollars for homelessness. So sometimes they administer it themselves. Sometimes it gets administered through the continuum of care lead, which could be a nonprofit entity, or, it could be the county. So there's quite a variety of ways in which this gets done, which I think is why, if you're unsure in your community, it's good to reach out to that housing email, because we can broker some conversations within your community to kind of help figure that out, because it can be a little bit confusing sometimes.
Great.
And I think there was one more question, Althea. It looks like it came from me, but it didn't. Will prevention incorporate diversion or problem solving?
Yeah, so I think, and diversion and problem solving are, one approach to serving, families, again, that kind of have a spectrum of housing needs. So if you think about what our programs will be able to offer, I mean, the short answer is yes. But the like longer version is that, prevention will allow kind of this, allow counties, and they have discretion in really designing the particulars around this, but to be able to serve families who are currently unhoused, including those who are chronically homeless, all the way to folks who are at risk of losing their housing. And diversion is certainly a part of that, and problem solving with families is certainly a part of that as well. So short answer is yes, but really, the goal would be that counties may be able to serve kind of a broader spectrum of housing needs. And Elena, is there anything?
No, I think
that you would add, or also question asker who is not Elena, if there's anything that you want to add specifically about the types of services or supports that you really think are most important to be able to bring to the table, would love to hear that as well.
And then I see that Marlo Nash is here, has joined us today, and she just put a comment in the chat that I think was really kind of like a great reminder as we hopefully will join each other again for the learning exchange. And she said, as you all consider together during the learning exchange about how to link child welfare systems and primary prevention systems to housing, it would be good to keep in mind that housing issues are also prominent with families who are living with substance abuse or disorders. There's another cross-system leveraging nexus to more fully support to support families: child maltreatment prevention, substance use disorder treatment, and housing. So I'm not sure if you wanted to add anything else, Marlo, to that, but I think that's such a important and actually really great point.
Yeah, I love this addition, Marlo, and I truly appreciate in the learning exchange, we really want to bring all of your brain, we want to leverage all of the brain power in the room, right? And all of the creativity and just sort of the knowledge, bring it all to the table so that we can really talk about what's possible or what's needed and where we want to be thinking a little bit more deeply, where can we deepen the understanding on either side of the sort of service table, if you will, where can we deepen our understanding of our programs and needs and what the best possible supports could look like. I love that, Marlo. That's really wonderful.
And then we have another question here. How might, from Sarah Lacqua, how might the nexus of domestic violence and homelessness be best supported with these funds and programs?
Yes, so we'll be able to say a little bit more about this once our funding letter is issued. Part of that is issuing updated guidance as well as some updated definitions. But we definitely think, especially around bringing families home, that we're hoping to make that connection more explicit, and be able to provide more housing supports for children and families that are fleeing domestic violence. This is kind of a recurring, or not recurring, but this is kind of a cross-cutting question, I think, for all our programs, not only children and family programs. And I feel like this is an area that I would also love to talk about, because I think we've made inroads and progress on it, but I feel like, at least for me, I think that that's something that I would love to talk more about, how housing programs can better be attuned to those needs.
And I think this does require, when we do sit at the table, that we kind of look across at all the potential partners, right? Like we have been talking about, not only, bringing in the conversation with our DV providers and, and just understanding that, this is one sort of a lane of funding for housing supports. And there are several others that we want to be attuned to, right? There's a lot of federal funding coming down in parallel to this, coming through the ARPA, the ARPA funds, and then, just our sort of typical allocations that come through the Department of Housing and Urban Development into communities. So we want to look at all of it and really figure out how do we leverage it best, right? And that is the overwhelming task that's that sort of is in front of us, right? But from the perspective of like, how can we what do we want it to look like? And then how do we really leverage all the things to make it work in our community?
Yeah, I think it's especially when families, they're like trying to navigate all these different systems. Sometimes I really liken like aligning systems to kind of like how Kaiser works. Everything's in the same building, physically, so people kind of know where to go and they don't have to like call and do all these things. And so hopefully we can start to think about systems in that way of how can we make it easiest for families who are stressed, who are maybe in a place where they're not able to, access that thinking those executive functioning skills in order to do what they need to do to make sure that their families are healthy and safe. So I really love to see that we're all thinking about this, and we know it's complicated, but the motivation that people have is really inspiring for this work. So it looks like we have gone through all of the questions. I'm not sure if anyone, before we move on, if we have anyone that wants to make a comment or.
I did have another question about the county's continuum of care. And right, and that's a really, that sort of title or term is pretty broad, right? I feel like, is there, just because I'm learning so much about the housing, housing field, is there a particular group in each county called the county's like housing continuum of care? Is that a network or is that an existing structure in each county?
It is, Sarah, and sorry, I sort of threw that out there without the explanation.
No,
commonly referred to as the COC, or the Homeless Continuum of Care. It is, it can be administered in a number of different ways, but essentially they are the administrator of federal funds within any given community. Sometimes there are what we call joint continuums of care. So for example, Monterey County and San Benito County share one continuum of care that is a nonprofit entity that is responsible for a few things, right? Administering federal funds, conducting the point in time count, ensuring that all of the, the sort of data is entered into the homeless management information system. And I think there's some folks from my team on the call too. You can see if I missed anything, but those are a few of the things that they're responsible for within the homeless systems of care. So each community has this, and sometimes it's a county that's the point person and is, sort of bringing together the city partners, provider partners, bringing all the folks to the table. Sometimes it's a nonprofit. And so there are a lot, in other states, California is particularly complicated. In other states, sometimes the state is the one continuum of care body that administers for the entire state, but California is always special. And we have lots of different configurations. Oh, thank you. So the other thing they're responsible for is setting the standards. See, I type it, I'm talking and I type at the same time. Setting the standards for how various housing programs are managed and performed. Right. Thank you.
Yeah, it makes me think about, for those who might be here connected to their county's prevention planning teams, right? Like what might be or who might be a good person to approach or an entity to approach to see how you might integrate the sort of housing continuum of care system within your child and family well-being systems, right? Like, is it a person that becomes that sort of connection and that nexus? Or might it be, right, like an entity, an organization?
I would say start with your county. Like we can do some of this brokering, Sarah, because it is a little bit different depending on which community you're talking about, right? And we've kind of learned along the way, like how it operates differently in each community. But the starting place is sort of your county sort of sister department, who's receiving the funds, these particular funds, right? Which would be your Department of Public Social Services or Self-Sufficiency Department. And they have a variety of other names in each county, but that would be the place to start. And then to see if they are directly administering those funds or if they have other partners where they are passing through those funds to another entity to administer.
Yeah, thank you.
And it looks like Sarah MacArthur mentioned that they have a specific committee for a COC committee for children and families. Sarah, I'm sorry, can you tell me again, what are you from Contra Costa? What county you're from?
No, I'm from Butte.
Butte.
Oh,
Yeah.
Butte. Sorry about that. Okay, great. Sorry, I forgot to unmute myself. So we're coming towards the end of our time together, but I just want to thank Althea and Elena again for sharing such wonderful and important information about the different housing programs and avenues that can support the families that we are currently supporting. And I wanted just to follow up and say that, please, if you have an opportunity to join us on our Aligning Fundings and Initiative Associated Learning Exchange Series, we will put the link for the flyer in the chat so that you can have that. We will also be sending a follow-up email that has the link to the YouTube for this recorded webinar, as well as the link to register for the learning exchange. So please look out for that in the next day or two. But we really want to be able to have this really great in-depth conversation around how can we really link all of these things to the current work that we're all doing and really make this alignment happen in our state and these different counties. I also wanted just to share that we are continuing this series with a webinar on community schools funding with the United Way and the Children's Defense Fund. So we've been really lucky to get such amazing speakers and subject matter experts in these different fields. So we'll be joined by Jose Vargas and Janice Connellan, and they will be able to share with us more about community schools funding. That also has a learning exchange session and associated learning exchange session as well, where we can kind of go into a deeper conversation about how that aligns to the work that you are all doing. So we hope to see you there. Please stay connected with us. We have a lot of events coming up that I think are helpful in the work that you all do. We have Facebook and LinkedIn. We also have a YouTube. So all of the webinars we do have been recorded and will be on our YouTube channel, Strategies TA. And as we also have our website, so please sign up for our newsletter. It will give you, updates about different events that we're having and just what we're up to and the work that we're doing. So, oops. Well, I just want to say again, thank you all for spending your afternoon with us. This was a really amazing conversation around housing and how we can continue to connect families to these important resources. We hope to see you again on November 16th from 11 to 12 for the learning exchange. And we will go ahead and put the flyer in again. But thank you all for coming. Let's see, can I do this? I did it, yes. And then also, if you haven't left yet, please fill out our Survey Monkey, just letting us know how you thought the webinar was. Really helps us out to target just the kind of information that you all are interested in. But if you don't have a chance to do that or you can't access the link, we will send it in the follow-up email.
Thank you for having us. It was a pleasure, and we look forward to our conversation next week.
Yeah, I'm looking forward to that.